Our first speaker today is Dr. Robert Jay Rowen. He is a Phi Beta Kappa graduate of the Johns Hopkins University and the University of California, San Francisco School of Medicine, where he acquired double board certifications and recertifications in family practice, emergency medicine, and clinical metal toxicity. Dr. Rowen is affectionately known as the father of medical freedom for pioneering the nation's first statutory protection for alternative medicine in 1990. He lectures widely on ozone therapy and the importance of the living foods diet. In October of 2014, he traveled to Sierra Leone to bring ozone therapy to the Ebola epidemic. His team had a 100% recovery rate by curing 5 out of 5 people with Ebola. He was the lead author of a report about this endeavor, which was published in the medical literature. Dr. Rowen currently practices integrative medicine with his physician wife, Terri Su, in Santa Rosa, California. Please join me in welcoming Dr. Robert Rowen.
My talk is on ozone therapy, and I'm going to bring you my experience and literature from 2 major researchers and my clinic. I have a conflict of interest. I'll disclose it. I teach ozone therapy in my office. So if you're interested in coming, you can contact me. That's my conflict. Here's my comment about ozone. With the exception of diet, nutrition, and stress reduction, ozone does more good for more conditions than anything I have ever used in medicine since 1976 combined. This one modality. Now, we're all health practitioners, whether dentists or physicians, and we're now reaching a point where we're on the cusp of a post-antibiotic era where even the World Health Organization, as corrupt as it is telling us that we're going to be facing diseases we can't treat. And the last antibiotics are falling by the wayside. So ozone really can step in and help us out. What is ozone? Well, oxygen is the most important factor in healing. It's the source of all energy, and it's the source of immune cell microbial killing ability. When our immune cells encounter a bacteria, it takes 10 times the amount of oxygen for them to turn on and do their job. That's called the respiratory burst. Well, ozone is not O2, it's O3. It's produced naturally in the stratosphere by ultraviolet radiation and also by lightning. It is not a poisonous gas. It is toxic to the lungs if you inhale it, and that's the only way that it is toxic. Please remember that. It is very irritating to the lungs to breathe it. It's the most powerful naturally occurring oxidant, and the only oxidant that we know is more powerful is fluorine gas. You can smell ozone after a lightning storm. Ozone is relatively stable. It resonates into 4 different structures. So it's got a half-life of about 30 minutes in room air. In triple distilled water, which might be useful for the dentist, it can easily last overnight and even several days in ice cubes. And bound in vegetable oil, it can last for years, like ozonated olive oil. Oxidants are electron-seeking. Ozone is the most powerful oxidant we have, and it will naturally be attracted to molecules that are rich in electrons. I'll show you that in a moment. Well, aren't we supposed to be scared of oxidants and use antioxidants? That is an old wives' tale. I'm not disparaging to wives. I have one. But it's falling by the wayside. Antioxidants might not be good, and oxidants might be good for us. For example, our immune system runs on these. There is a balance in the body all the time at this very moment of superoxide, hydrogen peroxide, even hydroxyl radicals, nitrogen radicals, bleach, ClO, even ozone, and nitric oxides of nitrogen. All of these are in balance in the body and critically useful for the immune system. Now, ozone here will typically attack an electron-rich double bond of carbon, split it, and create downstream ozonides, alcohols, aldehydes, and acids. And these are messenger molecules. The ozone, when you use it, is gone in microseconds, leaving behind this cascade. This is from Cuba, and a lot of what I'm going to present is from Cuban research. The early phase are called reactive oxygen species, and the late phase are lipid oxidation products. The early phase starts work immediately, causing these effects. The lipid oxidation products can last for days, weeks, even months. Hydrogen peroxide typically is an intermediate. A lot of guys are infusing hydrogen peroxide into veins. I stopped doing that many years ago because it was hard on veins. And ozone, the way we do it, is extraordinarily safe. Ozone is a medical gas mixture of about 97% oxygen and 3% ozone. Ozone creates an oxidative stress, and then by a cascade, it can induce genes, new enzymes, and it will activate antioxidant enzymes. So how do you make muscles? You pump iron. And that's what you're doing with ozone therapy by inducing antioxidant enzymes. This is Cuban research. They've done work on carbon tetrachloride poisoning, experimental diabetes, ischemia reperfusion injury, kidney failure, endotoxic shock. They have shown that preconditioning animals with ozone, giving the animals ozone before a stress, improves subsequent survival, whether it's a burn, poisoning, or infection. This is one of the effects they found. Under a microscope, if you take blood and put it on a slide, it can coin up in rouleau. And after ozone, the cells disperse, increasing the negative charge on the cells, so you get better rheologic properties of blood. We're going to look at basic science, but I'd like to, you kindly introduced my Sierra Leone adventure, so I'd like to talk about that for just a moment. Why ozone for viruses? Viruses have two key structures in their membranes that are vital for cell entry: lipids and proteins. Ozone here in this article knocks out Norwalk virus, poliovirus, and bacteriophage by ozone disinfection in water, and it can knock it out almost immediately. Here is inactivating polio. 99% is inactivated in the first second. Georgian medical news, direct antiviral activity, which can induce long-term remission of viruses and sometimes total remission from blood. This is the Ebola virus. It's got spikes on it here, which enable it. These are glycoproteins, which enable it to attach to a cell, and that it injects its single-strand ribonucleic acid. Now, the membrane of the virus is lipid. And here's an article that says alteration of membrane lipid composition can block viral release. So here I just showed you that virus, which has a membrane, the blue, and these spikes, these glycoprotein spikes. So getting either one of them, and this just doesn't pertain to Ebola. This will pertain to almost any virus. If you alter the lipids, you might be able to change its ability to enter a cell. Well, there are electron-rich bonds in those lipids because those lipids are made from our own cell membranes, which have unsaturated fatty acids. So if you oxidize them, you've changed the three-dimensional structure of it. Ebola is a lipid envelope virus with rich in double bonds, and it has glycoproteins, and the glycoproteins are very rich in sulfhydryl groups, SH groups, which can be oxidized almost instantly by any of these highly oxidizing compounds in the cascade. Thiol groups. Journal of General Virology. You've heard of CMV, cytomegalovirus. This article shows that if you oxidize the virus, you have knocked out its ability to infect cells. And if you then treat the virus with a reducing agent to restore its sulfhydryl groups, it regains up to 65% of its infectivity. HIV, same, thiol disulfide interchange. Oxidizing it is going to reduce its ability to enter cells. Ozone will oxidize SH groups to disulfides instantly and on contact. Our cells can repair this because we're aerobic. Bacteria and viruses lack the ability to repair. Viruses are inactivated. Here's more. HIV, vaccinia virus, all depending upon the sulfhydryl disulfide interchange. My comment is the sulfhydryl groups on the viral glycoproteins are like the fingers on your hand. You have to open a jar to get into the cookie jar. So you just grab it, open it up, and you can reach in. The sulfhydryl groups on a virus are like the fingers on your hand. And when you chop them off, oxidizing them to disulfide, you've just lost your fingers. The cookie jar is still there, but you can't get in. So I read all this material when I was contemplating going to Africa, and I thought, my God, I might be sitting on the best treatment for Ebola that God could have given us. Now, ozone disappears from blood very rapidly, as I mentioned, but it creates all those oxidants that are rather long-living, and they'll stay around for a while. We know oxidants can treat virus because way back in 1918, from the Lancet, British physician Oliver cut the mortality rate of the Spanish influenza epidemic by 50% with a penny's worth of hydrogen peroxide given intravenously. The world has lost this. People are dying in the hospital unnecessarily of viral pneumonias. What about bacteria? Antimicrobial effects of ozonated water against E. coli. Just 2 parts per million, easy to achieve, will knock out bacteria within a second. Here's the kill time. And even increasing the ozone concentration greater than 2 parts per million doesn't do better. Just 2 parts per million is going to knock out the bacteria. How does it work? Ozone approaches the bacterial cell wall, punches a hole in it, and it just lyses it. The bacteria hemorrhages. It would be analogous to somebody getting shot right through the heart and bleeding to death instantly. The bacteria can't recover. It's an instant kill. In nature, sunlight does the same thing with ultraviolet energy, oxidizing the membrane. That's why we don't see pathogenic organisms out in the atmosphere on a sunny day. You'll get it here in the hotel when we breathe in Legionnaire's disease. It might come in through the ventilation system. Don't stop breathing. Now, think about how ozone then might add to your dental practice, especially gum and periodontal problems. And I will also add that ozone cuts through biofilm like a hot knife cuts through butter. What about comparing ozone to bleach? In Sierra Leone, they were using toxic bleach to disinfect everything. Here's my comment down here. Ozone is 100 times faster kill rate than any bleach. 100-fold faster, and it leaves no residue. So why does ozone kill viruses and bacteria but not us? As I mentioned, the viruses and bacteria have no repair mechanisms, and the bacteria are just lysed instantly, so they can't do anything. We are made for oxidation stress. And our cells actually generate reactive oxygen species to hurl it at invaders, and that's how we kill them, with oxidants. Our cells actually make bleach. And from Science News, December 2002, our own immune system makes ozone. Here's the article. This is from Scripps Institute. And it says, neutrophil-activated antibodies react with singlet oxygen to create ozone in our own bodies. So this was very hard to find because ozone doesn't last but milliseconds, microseconds. They can't find the ozone. They're finding the molecular trace, the downstream metabolites of ozone. So that was really exciting for me. How does ozone work in infection? It floods the bloodstream with oxidants, killing the pathogens outright. Those molecules, those ozonides, are redox messengers stimulating the immune system. They're signaling molecules. Ozone modulates the immune system. It improves the rheologic flow properties of blood. It helps the red cells dump more oxygen into the tissues because one of its byproducts on the red cell is an increase in 2,3-DGP, which is required by hemoglobin to release its oxygen. And now a latest finding by one of my mentors, Johann Lahadny of Austria, it stimulates mitochondrial oxygen consumption. More ATP is produced when you do ozone. The bottom line of healing and infection resistance is oxygen, oxygen, oxygen. I became an oxygen man in 1986 when I did my first ozone treatment. After I got stunning results with the very first treatment, I just went into ozone, and that became the focus of my work. I did ozone, ultraviolet blood irradiation, limited hydrogen peroxide, and occasionally high-dose vitamin C. Okay, let's talk about Ebola. Into the eye of the cytokine storm. Ebola and some of these lethal viruses, which we face now, even the flu, stimulate the immune system to induce what's called a cytokine storm. The immune system is so highly activated that very active molecules pour out to get the invader, but it also gets us as, quote, innocent bystanders. And that's how Ebola works. When the immune system comes out to see the Ebola, when it finally comes out, it damages our own tissues and you hemorrhage. This is very similar in other viruses that are lethal. Tumor necrosis factor is perhaps the best known of these and studied of these cytokines. This is Cuban research, which I think you will find interesting. We know that you can suppress the immune system with steroids. So this last one over here is a suppression of tumor necrosis factor alpha with dexamethasone. Here is the use of ozone by intraperitoneal in animals. And here is the use of ozone suppression simply by giving it by rectal insufflation. Ozone is an absolutely phenomenal modulator of inflammation, on a par with steroids with no toxicity. Ozone, unlike steroids, it inactivates viruses on contact. It seemed to me to be the ideal treatment for these types of infections, any deadly infection. So realizing the potential for my life's work, I decided to go to Africa. I recruited Howard Robbins, who pioneered direct intravenous gas, giving the ozone gas directly in the vein. That's controversial. I'm not going to cover that much here. He refused at first, saying, I'm not going to go. I'm not going to die. I said, fine, I'll go, and I'm just going to use your method. He said, I'm not letting you get all the credit. He took 2 seconds to come to that decision. And he changed his mind, and we went. So here we were in Sierra Leone. There were signs everywhere, beware Ebola. These are the doctors that we trained in how to do the technique. We actually got to visit the president. And here's our article. Rapid resolution of hemorrhagic fever in Sierra Leone with ozone therapy, published a couple years ago. We had this article covered 4 cases, serologically confirmed and or symptomatic, and the 5th one we thought was preventive. I got a letter from the 5th one about a 1.5 years later, thanking God for ozone, because she wouldn't tell anybody that she was already symptomatic, because if she had told them, she'd have been thrown in the can and denied all treatment by the government, and she probably would have died. She would have had a 60% chance of dying. So we had 5 cases, symptomatic and or serologically confirmed. The statistical probability of that, getting them all in that epidemic with a 40% recovery rate, would have only been 1%. After our visit, the Ebola mortality fell at that treatment center from 60% to about 25%. No one knows why, but our first survivor, who was a physician, clandestinely spirited in ozone water and ozone gas to give to some of the patients, and they recovered. It was amazing that these people recovered almost immediately. And Ebola has this type of course: asymptomatic, 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 and then when you get symptoms, you just crash. and then you down here, and it's 60% chance you're going to die. We got to these patients very early, and they did not crash. We got to them just as soon as they were getting symptomatic, symptoms leveled off. So what about direct intravenous oxygen gas? We got a lot of people criticize us for doing it this way. Here are articles that show that if you give direct gas, and you'd think, oh my God, I'm giving gas embolism. Well, this is not air. Air is 80% nitrogen. And there are studies in the literature, There are studies in the literature that if you give oxygen gas intravenously, you stimulate the immune system. And in this particular case, you stimulate an important anti-inflammatory enzyme called 15-LOX1. And these Europeans are giving up to 50 cc's of intravenous oxygen. Effects of intravenous oxygen on prostacyclin and thromboxane. Thromboxane, for me as a medical doctor, is not good. It induces clotting and inflammation. Prostacyclin is the premier vascular lubricator. If you don't have abundant prostacyclin, which is a omega-6 series prostaglandin, you won't have any good circulation. Ozone improves that ratio. Significant. Intravenous oxygen does. So does ozone. This is Regelsberger, who studied intravenous oxygen gas for a long time. The rheological properties of the blood, as well as diuresis, are improved. That means elimination. And release of oxygen into the tissue is increased, and blood pH is normalized. That means that you're going to become more alkaline from your diseased acidic state. He liked intravenous oxygen better than hyperbaric oxygen therapy. It's less complicated, less expensive, and probably of higher efficacy. All of us can do intravenous oxygen. You don't even need an ozone machine for that. This is another oxidation method that I've used for years, and I actually have this machine. I'll show you. This is ultraviolet blood irradiation, published in the American Journal of Surgery in 1944. And this shows down here, this is just when antibiotics were just coming out. And ultraviolet blood irradiation, which is ozone's sister therapy, they treated osteomyelitis, appendiceal abscesses, septicemia, all kinds of abscesses, pelvic abscesses. If you caught the infection early, 100% cure rate. If you caught it moderately advanced, a 98% cure rate. And if they were dying, comatose, almost a 50% recovery rate with 1, 2, or maybe 3 treatments. This was astounding. There's only 1 or 2 of these machines left on the planet. That's my wife standing next to a machine that we have that was built in 1958, and it's still functioning. And we use it. Ozone therapy is seen by Sylvia Menendez, the Cuban pioneer, Vilio Bacci, and me as a clinician. This is a book, Ozone, a new medical drug. It's available. You can get it online. Medical ozone can be administered all these ways. The so-called pundits don't like it to be administered as a gas. There are some problems with it. It's very hard on veins, and for that reason, I do very little of it. You can give it subcutaneously, IM, rectal, vaginal, bladder, intradermal, topical gas. I give it all these ways. And I even give it in the femoral artery. You can give it intrapleural. You can use it on teeth. I inject it around teeth. You can use ozonated oils. You can give it every way that you can imagine except one. Can't breathe it. Here's what ozone does. Without 2,3, this is the, I'm sorry, this was truncated. This is the oxyhemoglobin curve. And with 2,3-DGP, the oxyhemoglobin dissociation curve moves to the right in this direction, which means oxygen release. And if you don't have 2,3-DGP, the oxygen tension has to fall to a very low level, pressure-wise, for the oxygen to come off of the hemoglobin. And now you have very low pressure, and it's pressure that moves the oxygen across membranes. So you want the oxygen to come off of the hemoglobin at a much higher Torr pressure. And 2,3-DGP does that, and ozone helps to increase that. Bocci found that ozone induces human umbilical cord epithelial cells to increase nitrite production, nitric oxide, vasodilator. Cytokines. In a series of articles, Bocci found that it increases all of these cytokines and transforming growth factor beta, and it also increases, yes, transforming growth factor beta, interferon alpha, beta, and it modulates the immune system. What the researchers have found, there's a Th1 and a Th2 pathway. Th1 is cellular immune system, Th2 is humoral. If one's out of balance like this, ozone tends to bring it back. If it's out of balance like that, it brings it back into balance. TGF-beta activates cartilage cells to produce matrix enzymes, so you might be able to help rebuild cartilage. It's released from macrophages and platelets under ozone influence. TGF-beta I like. I put ozone into joints, and we see amazing things, which you will see shortly. And it induces SOD, superoxide dismutase, to reduce oxidative damage. Immune activation continued. All this is saying is that ozone is an extraordinarily powerful modulator, inducer of the immune system. Antioxidant effects, it induces SOD, catalase, and glutathione peroxidase. It's a paradoxical increase. As I said, you build muscle by pumping iron. By putting in a peroxidant into the system, you're pumping the muscles of your antioxidant enzyme system. Here are some of what it does overall. It activates immunocompetent cells. It enhances RBC metabolism and oxygen release. It increases enzymatic antioxidant status. It actually increases protein thiol groups. Remember, I showed you earlier that in viruses it oxidizes them to disulfides, but in us, aerobic organisms, it paradoxically has the opposite effect. It increases nitric oxide levels. It increases H2O2, which is a signaling molecule. There's hundreds and hundreds of articles on hydrogen peroxide. And it increases transforming growth factor beta. When you do ozone therapy, this is from Silvia Menendez in Cuba, you get an increase in the partial pressure of oxygen in the arterial system and a decrease in the partial pressure of oxygen in the returning venous system. So the difference that you see here is oxygen consumption. So with ozone therapy, you get more oxygen. This is the total oxygen consumption. So that indicates mitochondrial combustion of oxygen, which is what we want. Safety. In the 1980s, a German study showed they studied several 100,000 ozone applications, and they found it was almost 100% safe. The only complications they found was when it was given directly intravascular by a bad method. What are the indications? Circulation, external ulcers, intestinal pathology, infections, adjunctive therapy in cancer, geriatric conditions, rheumatoid arthritis and inflammatory conditions, connective tissue diseases, dental ozone, lumbar disc disease, and joints. These are just some of the indications. How about Lyme disease? I'm not here to talk on Lyme, but I will be speaking on Lyme at the Lyme meeting. And I would say we're getting a minimum of 80, maybe 85% Lyme, probably remissions. And the patients do very well with this. It's hard to believe. You need to go to my YouTube channel to see the patients. And I'll show you my YouTube channel in a moment. So this is 27 years applying ozone therapy in Cuba. I showed you earlier, these are all the studies that they conducted on animals and humans. This says survival percentage of animals with lethal peritonitis using ozone and antibiotics So there's synergy in using ozone with your antibiotics. And I know all of you have to be using antibiotics because you're all dealing with mouth infections. So what this says here is if you give ozone, you get a step up of survival in the animals from 72% from just antibiotics at best to 92%. That's a pretty good increase. Acne rosacea. Here's ozone treatment of acne rosacea. I'm just going to go show you some of the things that ozone can be used for now. Infections. This is my patient. I've submitted this for publication. We'll see if they take it. It's like pulling teeth to get an ozone article published. This guy was an old-time patient of mine. I saw him for Lyme disease in 2011, and he was my first YouTube. He convinced me to start putting my cases on YouTube. So I put him up there for Lyme in 2011, and then he comes to me in 2015 with tick bite cellulitis. I mean, he doesn't learn his lesson. So I sent him out with a prescription with antibiotics because I said, this is a legal issue. You're going to take this prescription with you so I can chart it. He says, I'm not taking it. I said, he says, I don't care if you don't take the drug. You're taking the prescription with you. So I could write it in the record. So he says, but I'm not taking it. I said, take the prescription. He did. He took it with him. He didn't fill it. And this is like a couple days later after a single high-dose ozone treatment. Didn't get an antibiotic. This is a fellow who works for us in our small backyard orchard that you see here. His name is Daniel. I have permission to use these slides. This is also submitted for publication if they'll take it. He came to me with dermatomyositis, a bad connective tissue disease. Here's what he looked like on methotrexate, Imuran, 80 to 120 milligrams of prednisone and Plaquenil. His CK was the highest I had ever seen in my career. It was over 9,000. In my backyard, back here, I mean, I knew this guy for about a year, and then I see him looking like this in my backyard one day, and I said, what's going on? And he doesn't speak much English. And he said, Dermatomyositis. And he tried to explain to me what was happening, and I don't speak much Spanish. So in my backyard, I examined his teeth. And I said, you've got dental issues in at least these particular teeth, and I'm going to treat you with ozone right now. And in my backyard, I injected a couple teeth. We're going to talk about that this afternoon. And his pain went away. This guy couldn't even work to earn money for his family. His pain went away on the spot. Then I gave him ozone, and now you see him better. And he's living a normal life today after he cleared out the dental infections, and he got lots and lots of ozone therapy. This is a case of rheumatoid arthritis. When I first saw her, she was on methotrexate, told to take Enbrel. She received oxidation therapies, got the infections cleared out of her teeth. She's off of all drugs now, and she still comes to me because she's got very, very low-grade inflammation in her couple knuckles, and we continue to treat her for that. So, whoa. How come that didn't come on? That's a video, and that should have played. And I don't know why it didn't play. Let me see, let me escape this and see if I can get that to play. Nope. All right, I can still play it because I can get back to it. From chronic fatigue to superwoman in just 2 days. I'll try to get that. Cancer, ozone and cancer. Why might it work? Cancer is largely anaerobic. And ozone, I have a couple articles here that shows that by increasing the oxygen tension in cancer cells, you might make them behave less aggressively. Tumors thrive in hypoxic environments. So the theory is get some ozone in there, get them more rich with oxygen, get the immune system turned on, and maybe we can get some work. we can get the immune system to work. Here's a pilot study. It says on the bottom, despite being administered over a very short period of time, ozone therapy improved oxygenation in most hypoxic tumors, and it suggests research. So after seeing this and having a small cancer practice, I decided I would do some things, and I did the triple oxidation therapy, and I'll show you my very first patient. Here they postulate that because of the prolonged hypoxia, ozone autohemotherapy might improve your outcomes. So this man was, at the time, was 76 years old, stage 4 colon cancer. He's a Swami from India. And he had 2 10-centimeter metastases the size of my fist in his liver. And his doctors had given him up for dead. His followers begged us to take him, and I really didn't want to because I didn't think we had a chance. Here he is at one of their spiritual meetings. So I first saw him in around 2010, and his alkaline phosphatase was 582, and he looked like death to me. And within a couple months, you can see his alkaline phosphatase falling to normal. He got better so fast, he didn't want to come in anymore. He says, I don't have cancer, I don't have cancer. I said, you do, because you're still anemic, which you can see here, down at the bottom. And I said, you're still bleeding. So a year and a half after it, when the tumor liver mets went away, I said, get surgery on the primary, which he did. 4.5 years later, his labs are normal, and he's still alive, and he retired 2 years ago, which is now, he's now 8 years out, and he retired to India. He's hiking, I guess, in the mountains there. So that was my very first case that we did, and we have a few others like that too. Here's what happens to the enzymes, glutathione peroxidase. And MDA, methylmalondehyde, is a toxin. It's a molecule that we can measure that's indicative of severe oxidative stress. And it initially goes up with ozone, and then it promptly falls as we get the antioxidant enzyme systems revved up. Arteriosclerosis and ozone therapy. This slide is interesting because here they took ozone therapy by 3 different methods. They did intravenous, intramuscular, which is a very easy method to do, and rectal. And they found improvement in all 3 groups compared to placebo. So ozone is so versatile, you're going to get results almost no matter how you give it. Intraarterial injections. And I have some pictures which I'll show you. I have given it into the femoral artery without any problem. Here's major autohemotherapy in chronic limb ischemia with ulcerations, and ozone therapy works better or as well as cutting the sympathetic nerves to the legs. Here's what happens in some chronic ulcerations using ozone therapy. You get healing. Speaking of pre-treatment like the Cubans did, since day 1 of ozone in 1986, I started using it for any of my patients who were bound for surgery or a dental procedure. I haven't had one known complication in 30 years. In other words, not one wound dehiscence and not one wound infection in any patient. Now, I don't have hundreds and hundreds because most of my patients avoid surgery, but we have quite a few, and they do extraordinarily well. In Alaska, I had a patient get a total hip replacement, and she was up and walking around the next day without any drugs, pain pills. The orthopedic surgeons couldn't believe what they were seeing. She says, well, I saw Dr. Rowen for ozone, and they turned around and walked out. Typical. Prostacyclin, this is a Cuban study. Sorry it got truncated, but prostacyclin increases after ozone by intraperitoneal insufflation. Again, prostacyclin is one of the important mediators for good circulation and healing. It's undisputed that it improves vessel tone, it's anti-proliferative, anti-thrombotic, anti-inflammatory, and anti-mitogenic. Here is a comparison of ozone therapy to hyperbaric oxygen. And ozone therapy improves blood viscosity. Hyperbaric oxygen didn't. So there is hyperbaric oxygen is wonderful, but I consider it more of an oxygen treatment, oxygenation treatment. Ozone therapy is an oxidation treatment having different biochemical effects. Both are very valuable. This was in patients with peripheral arterial disease. What about pregnancy? Here is an article that was published in the year 2000 where pregnant women were treated with ozone and their placentas, and they were at risk of premature delivery. And the ozone sustained them and matured their placenta. In the main group, the placentas were smaller, and after ozone therapy, they had enlargement of the terminal villi. So they found a stimulating effect of ozone on the growth and differentiation of the placenta, sustaining the pregnancy. I use ozone on pregnant women regularly, but I will not do it in the first trimester. I don't even want to see a woman in the first trimester for legal reasons. The use of ozone therapy in nose correction applications. I'm throwing that in here because ozone has helped surgery, and this should help in the healing of any of your dental procedures. Age-related macular degeneration. This is Bocci's work. It shows that superoxide dismutase goes up with ozone therapy, and MDA, the bad guy, goes up, and then it comes down with ozone therapy. Ozone treatment reduces blood oxidative stress and pancreas damage in a streptozotocin-induced diabetes model. This is Cuban research. In other words, animals given ozone rectally and then induced pancreatic islet cell wipeout with streptozotocin, ozone modulated that and actually preserved beta cell functioning. So this could be used for type 2 diabetes. I haven't seen it work very well for type 1 diabetes. Senile dementia, more Cuban work. Nice results with senile dementia. We've seen it, Alzheimer's disease as well. I actually have one case of Alzheimer's disease that apparently totally recovered. I can't find him now. Superoxide dismutase goes up and catalase goes up. Parkinson's syndrome in the elderly. This is all Cuban research showing improvement in symptoms. Lumbar disc. This is Italian research. They actually will inject the disc with ozone. Over 80% results. 80% of patients were enthusiastic. At the World Ozone Congress in Italy, in Ancona last September, I spoke on my Sierra Leone story, and there were 6 neurosurgeons who had largely given up surgery to inject ozone into discs. And they slashed these are from third world countries. They had slashed their prices by 2/3, and they were making a lot more money because it was relatively non-invasive, and they could do many more patients. In this, I have a few articles here to show you on back pain, because the first one is shooting the disc directly. I typically take a needle down to the facet joint and treat the facet joints with ozone. And then there's an article here that says you don't even need to go that far. You can just shoot it in the muscle. Here's an article that shows periarticular, they were comparing ozone to periarticular steroid infiltration, and the oxygen ozone does just as well as epidural steroids. Yet our doctors here are still using epidural steroids, which are toxic and have a very limited effect. Here is another article, low back pain, sciatica. Ozone here is given by intramuscular, the paraspinal muscles, and it worked almost as good as going right down to the joint and disc. What about knee osteoarthritis? I see lots and lots of that. This is Cuban research, and if you look down here, you'll see that glutathione in a healthy control should be about 570. In the initial knees that they were treating, it started at 49, and after they did a few sessions, it went up to 268, and the antioxidant enzymes improved. This is a simple treatment. That's how it's done. This is a Brazilian study on knees that was presented in San Francisco a couple of years ago, showing that knees do unbelievably superbly with ozone. Simple treatment, and I do a lot. Now this should come on, because I just checked it before, and it's not. And you have to see this. And I don't know why it's not coming up. So you're going to forgive me, and I'm going to escape that and come over to movies. Whoops. It worked up there, and I don't know why it's not working here, and I apologize for that. Okay, here we go. Today's March 1st, 2018. We're here with Casey, and her husband's in the background, and both of you have given me permission to video this, correct?
That's
This is
correct.
important for all of you. Get results and put you up on YouTube. Is that okay?
That's correct.
Thank you very much. Okay. She's got hip problems, back issues, and neck issues, and she's got some root canals. So what we want to do is see her get up out of the chair and walk to the door. Okay, you can come back now. She's in tears, and you don't look too happy. All right, sit down. Okay, now I'm going to have you get up on the table. This knee is a problem. You're hurting when I do this, aren't you? Yeah? Look at her. You got her face? Yeah, she's hurting. Look at her. So I'm going to speed this up, because I'm going to be presenting this in the afternoon. And we're about ready to leave. Can we see the end of the session? No hands.
No hands.
Walk to your husband, please. All right.
Thank you.
Thank you, and I want to thank you very much, both of you, for giving me permission to use this video.
You bet. Thank you, doctor. I hope it helps a lot of people.
So let me turn that off for a moment. That slide, this was important because you might think that I shot her with ozone in her knees. Not so. I stuck that case in here to coerce you to come to my afternoon session. This woman started walking like that because I shot up her teeth. Surprised? Anybody not surprised? I see some hands. Okay, we're going to be talking about that this afternoon. She had 3 root canal teeth, and I found them. I found the ones that were positive, and I shot them up. And she could walk again. So let me come back to the first movie I wanted you to see, From Chronic Fatigue to Superwoman in 2 days. Now I'm going to speed that up. She was battling chronic fatigue, 31-year-old nursing student. She came to me from Texas. This was our early days of high-dose ozone therapy. October 1st, 2015, we're here with Bailey, who I just saw a couple days ago. Bailey came to me with chronic fatigue, right?
Mm-hmm. Yes.
And adrenal weakness.
Yes.
And you just had no energy.
I had no energy at all. I was in bed for 2 hours a day. I'm a student, and I noticed that I wasn't retaining my material at all. Hard for me to study. brain fog.
And what happened to you with one high-dose ozone treatment?
I feel like I'm Superwoman. I used to smoke prior to this. I actually would crave it, and since the treatment, I have not wanted to pick up a cigarette at all.
And you said you're Superwoman, you could climb up something?
Well, yesterday I went to Bodega Head, and I noticed on the way back.
She went to Bodega Head, that's cliffs along the Pacific Ocean, and started hiking up the cliffs. She couldn't have done that before. That's just in 2 days. The next one I want to show you is this one here. So he also has probably having a very significant problem with Candida. She's had 5 or 6 different antibiotics this year alone. She's been treated for H. pylori. She has fatigue, muscle stiffness, muscle soreness, cramping, fatigue, symptoms of hypothyroidism, and her knees are in really bad shape from arthritis. And that's what I wanted to show you first, is the knees. So there's a shot of one of her knees, but I'm going to ask her if she would please get up out of the chair and walk to the door. Please watch how she walks. We haven't done anything with her yet. Look how difficult it is for her to get up. Now walk to the door, please.
It's actually easier because 2 minutes ago I got up, so it was...
Okay.
Yeah.
Please walk to the door.
Muscles are a little bit stiff. I am. Until I get walking.
Okay, and come back to me. Difficult. Okay.
Yeah.
This is an ozone treatment to her knees. Say that again?
So get up, down.
Yes, please get up. Okay, now what?
Gee.
What?
Yeah.
What'd you say?
Gee. Yeah.
Yeah? Yeah what? Yeah?
Yeah.
Yeah what?
Yeah, I can walk with no pain, with no stiffness.
Okay, walk to the door.
But hey, look at this. Hey, look at this. Hey, I need it. This one is still a painful injection.
I know you mean it. Okay.
But my right one, look at this.
Walk to the door and back.
Gee, I can walk totally straight, no problem.
Can you believe that?
Yeah, I can even a little swing, you know.
Are you happy? She only needed one more treatment. This is a woman who was headed for bilateral knee replacements. So let's come back to the slides. Oh, this one is working now. I don't know why it wasn't. This is what I just showed you. I call it an oh my God response to knee prolozone because after I did this, she just went, oh my God, oh my God. She couldn't believe it. These are all posted on YouTube. I am actively injecting temporomandibular joint now with overall wonderful results. This is something that is in your field. And I don't need to show you this. This is a woman who had really serious neck issues, and she just had one ozone treatment to her neck, and she was in tears when she came back because of the good results that she had. So I wanted to show this to you again. This is intraforaminal ozone versus periarticular steroid infiltrations for pain. And the conclusion down at the bottom is, it says, ozone treatments was highly effective at relieving acute and chronic lower back pain and sciatica. The gas mixture can be administered as a first treatment to replace epidural steroids. I'm sure you see zoster before and after. Ozone therapy is incredible. Blood ozone therapy is simply miraculous at herpes zoster. And neither I nor Howard Robbins has seen a case of post-herpetic neuralgia when we get to one of these patients during the acute outbreak. Lesions are gone usually in a matter of days. This is Cuban work, safety and toxicity profile of ozone therapy by rectal insufflation, very safe. They really went to work on trying to induce damage to animals, and they couldn't by rectal insufflation. Very, very safe. I teach my patients how to do it in the office. It's a home ozone program where we show them how to make ozone water to rinse their mouth, maybe ear insufflation, which does work. And they found no toxicity. We teach them how to do ear insufflation, ozone water, and rectal ozone. This is my YouTube channel. This woman here, Indian woman, I go do volunteer work in a charitable Indian hospital every couple of years. About 2 minutes before this, she had a frozen shoulder. So she's a happy camper. And this is the woman that you just saw. Oh my God, knee pain relief. And this is, we do training workshops. And here's some happy doctors that were happy to be videoed so I could put it up on the YouTube channel. The channel is Robert Rowen, MD. Can any of you think of one reason why ozone is not mainstream all over the country? Huh? Somebody over there got it. You can't patent it. The potential destruction of the current system of chronic disease maintenance. And I'll tell you briefly what happened in Sierra Leone, because I heard it from a dentist in Africa only about 6 months ago. Our project was scuttled. This would have made world attention. We were invited by the president of Sierra Leone to come. And while I went out to the treatment center to train the doctors, Howard had already come back to this country. A call came in from the Assistant Minister of Health to the military chief of the Ebola Center saying, if you allow ozone there, if you value your job, you will not permit ozone at the treatment center. 5 minutes later, a second call came in from their Minister of Health telling him the same thing. When they told me that, I felt like literally I was kicked in the you-know-whats. I lost it, and I'm a really cool temperament. I don't get angry, but I lost it. I couldn't believe it. I said, I said, this is akin to, in my opinion, Nazi atrocities, and there are people here who are going to die. The doctors lined up for treatment. We weren't allowed to treat any of the patients, but the doctors lined up. They wanted it. We did them all who wanted it. And one of them I actually photographed. He was our first case that got Ebola 3 weeks later. And he clandestinely got ozone, clandestinely, and recovered instantly. He was back at work a couple days later. He got it from a contaminated needle stick. And then he's the one who started bringing the ozone into the center. And I found out that the WHO went in at the behest of pharma and told their ministers that if the ozone project was allowed to continue, pharma would not only pull out of Sierra Leone, it would pull out of all of Africa. Now you know what's going on. Thank you for the honor of your presence. I'm going to restate what I said before. With the exception of diet, nutrition, and detoxification and stress reduction, ozone does more for more conditions than anything I've ever seen in medicine combined. I'm honored to be here. Thank you very much.